Pancreatic cancer is a complex and challenging disease. It often presents at a late stage, making treatment difficult. The pancreas is an organ located deep in the abdomen, making early detection challenging. Symptoms like jaundice, abdominal pain, and weight loss often appear late. This makes early diagnosis and treatment crucial for improving outcomes. Treatment for pancreatic cancer typically involves a multidisciplinary approach. This may include surgery, chemotherapy, radiation therapy, or a combination of these modalities. The choice of treatment depends on various factors. These factors include the stage of the cancer, the patient's overall health, and genetic profile. A critical step in planning treatment is determining if the tumor is resectable. Resectability refers to the possibility of surgically removing the tumor completely. This assessment is based on imaging tests like CT scans and MRIs. Tumors are classified into 3 categories: potentially resectable, borderline resectable, and locally advanced unresectable. Potentially resectable tumors have a high likelihood of complete removal. Borderline resectable tumors have features that make surgery more challenging. Locally advanced unresectable tumors cannot be removed surgically. Genetic testing plays a vital role in pancreatic cancer treatment. It helps identify mutations in genes that can influence treatment response. One crucial set of genes is involved in homologous recombination repair, or HRR. HRR is a process cells use to repair damaged DNA. Mutations in HRR genes like BRCA1 and BRCA2 can hinder this process. Patients with HRR deficiencies may respond better to certain types of chemotherapy, like platinum-based agents or PARP inhibitors. Identifying these mutations allows for personalized treatment plans, potentially improving outcomes. Tailoring chemotherapy for optimal outcomes. Chemotherapy is a cornerstone of pancreatic cancer treatment. The choice of chemotherapy regimen depends on several factors. These include the tumor's resectability, the patient's overall health, and genetic profile. For patients with resectable tumors, chemotherapy may be given before surgery, known as neoadjuvant therapy. This aims to shrink the tumor, making surgery easier and improving the chances of complete removal. After surgery, referred to as adjuvant therapy, chemotherapy helps destroy any remaining cancer cells and reduces the risk of recurrence. The fight against pancreatic cancer continues, with researchers tirelessly exploring new therapies and treatment approaches. Emerging therapies offer hope for improved outcomes and a brighter future for patients. Immunotherapy is a promising area of research. This approach harnesses the power of the body's immune system to recognize and destroy cancer cells. Clinical trials are underway to evaluate the effectiveness of immunotherapy drugs in pancreatic cancer, with encouraging early results. Another area of focus is targeted therapy. These therapies are designed to specifically target the molecular alterations driving tumor growth. By blocking these signals, targeted therapies can halt or slow cancer progression. High-intensity focused ultrasound is a non-invasive technique that uses sound waves to destroy cancer cells. HIFU shows promise in treating locally advanced pancreatic tumors, offering a potential alternative to surgery or radiation therapy. The future of pancreatic cancer treatment lies in continued research, innovation, and collaboration. By supporting these efforts, we can accelerate the development of more effective therapies and bring new hope to patients and their families. Seeking personalized medical advice, a priority. Pancreatic cancer treatment is complex and constantly evolving. It's crucial to consult with a healthcare professional for personalized medical advice. They can assess your specific situation, discuss treatment options, and answer your questions. Remember, this information is for general knowledge and should not be considered medical advice. Always seek guidance from a qualified healthcare provider for diagnosis and treatment decisions.